Today we're going to try and treat a sebaceous cyst. Amanda has a little cyst here on her chest. It's not too large, but yeah, it's one of the more difficult procedures to treat with advanced cosmetic procedures. It's not always as successful as some other methods or other conditions that we treat, but we're going to have a go and see how it works. Can we just get a closer up, Charlie, and just sort of show? So this is what we're trying to treat today. Okay. Light not in the way. So we've got it on a diathermy current. The foot pedal. Got it on a diathermy current. We're going to be going in and out of it a few times, literally almost trying to blitz it or fry it. It is going to feel a little bit uncomfortable, okay? You alright?
Yeah.
Yeah? Cool. So I'm just going to try and go into the middle of it. I'm just going to pierce it first of all. You alright?
Yep.
Okay, I'm in. So you're really not pretty going to see very much at this stage. How's it feeling?
Yeah, that feels fine.
Is it alright? So I'm
Yep.
just going to go in, and I'm just going to go in, then trying to get into the same place. So I'm not re-piercing it, but just trying to get around the edges, so that we're starting to go in. You can see it a little bit, perhaps going a little bit whiter. And I'm just holding the current in there for a while. How are you doing?
Doing fine, thank you.
So I'm just going to see if anything wants to come out. Sometimes you can extract a little bit of sebaceous fluid, but yeah, it's pretty solid, that one. I didn't think we were going to be able to do that, to be honest. And this is where I was explaining to Amanda before we started that there might be a little hole left in the middle, because obviously we've had to go in and out of the same place a few times. You feeling it a bit warm?
It's a little bit warm.
Not unbearably
Feels fine,
so.
not unbearably at all. No, it's just a little bit of discomfort. It's fine.
I might just try and take the current up just a little bit, okay?
Yep.
Because I have kept it on quite low just to make sure that everything is okay. How's that feeling?
That feels fine.
Bit hotter, but okay.
Yep.
So you can see it's come up a little bit puffier, but other than that, there's not a lot of change to it at this stage. What I would expect something to happen is probably it to go a little bit black, Amanda,
Okay.
afterwards. And then hopefully we just have to see if that sort of dries out. Not feeling too warm or anything, so
No, it's fine.
just going around it sort of again and just making sure that we've got into the deeper layers a little bit. The good thing is about this method, if we can get it to work successfully, is that obviously we've got no cuts. We haven't had to physically cut it out the skin, so we've got no scarring that way. Shouldn't really leave any scarring or marking, just maybe that hole. Okay, I'm going to leave it there. And then we're going to have to come back to it next month
Okay.
and see whether it needs a further treatment. Sometimes these do need more than one treatment. But we'll just have to see how this responds. See Amanda again in a month and then assess it from there.